I have chosen to do my first health education program assignment on tobacco use and the cessation of tobacco use. First, let's start with a pre-quiz. Why do people use tobacco products? Provide one reason. What is one consequence of tobacco use? What is one method of smoking cessation or the cessation of using other tobacco products? What is one symptom of withdrawal? What is one support option of the cessation of tobacco use? And finally, what is one benefit of the cessation? People use tobacco products for many different reasons. These reasons may include coping with trauma. Many veterans smoke cigarettes to cope with PTSD. Often if people are in a negative mood or under stress, they may feel the need to smoke a cigarette or use chewing tobacco. This may also happen because it is simply a habit. People become accustomed to having something in their hands or in their mouths and may chew on straws while they are trying to quit smoking. What are some of the consequences of using tobacco products? The use of tobacco products can lead to many different consequences. For example, smoking may cause cancer, heart disease, stroke, lung disease, diabetes, COPD, eye diseases, and problems of the immune system, which may also lead to conditions such as rheumatoid arthritis. Secondhand smoke can also be very serious. Secondhand smoke may cause a stroke, lung cancer, coronary artery disease in adults, and sudden infant death syndrome in infants. In our children, it could lead to insufficient respiratory function. There are also many consequences of using tobacco products, particularly smoking, while you are pregnant. Let's discuss some of the consequences of smoking cigarettes while pregnant. Babies born to mothers who have smoked cigarettes often are born preterm. As such, they often have a low birth weight, insufficient respiratory function, and have an increased risk of sudden infant death syndrome. These babies often spend time in the NICU before they are able to come home. They also often may be colicky and cry more than typical babies, as they may go through the same withdrawal symptoms as an adult would. These symptoms can include irritability, stress, insomnia, and anxiety. Chewing tobacco can also be very serious. Chewing tobacco can lead to cancers, not just oral cancers, but also throat cancers, gum disease, and leukoplakia, which is the white spots in the mouth, as seen here, particularly at the bottom gum line. It can also lead to tooth decay, as seen here. In my career, I have worked with someone who actually lost his tongue as a result of chewing tobacco. So how can we quit using these tobacco products? Of course, there are the typical methods such as nicotine patches or nicotine gum. There are also nicotine tablets that you can insert in your mouth that dissolve and help you control your cravings. Cravings may also be caused by certain triggers, so it's important to identify them so you know when you may need an extra piece of nicotine gum or a tablet. But we're going to talk about another method of smoking cessation or chewing tobacco cessation that is not as commonly talked about. As with any addiction, it is important to tell your family and friends that you are quitting. It is also important to tell them why you are quitting, as they can remind you of these reasons when you are feeling vulnerable. Ask your friends to check in on you and make sure you are staying accountable. Ask your friends to help you. Ask them to push you. Ask your friends and family to never ever buy you tobacco products, no matter what you may say. If you are close to someone who also uses tobacco products, this would be a good time to ask them to quit with you. Having a partner in this process can keep you both accountable. And lastly, let your loved ones know that this process is going to be difficult for you. You may be in a poor mood. You may not sleep as well in the first few days. You may experience anxiety. Let them know that this is not personal, and be patient. There are many support options for tobacco use cessation. Try a text messaging program, which can be available 24 hours a day. Download a smartphone app. These apps are free and can help you track your cravings and understand your smoking patterns. Visit social media groups and grow your network. This can also help you, as these people are not people you know, and you won't feel as embarrassed by your moments of weakness. A common social media group is Smoke Free in one word. Text an expert at a quit line. A common quit line is the National Cancer Institute quit line. More information can be found on their website. Also visit your local Department of Human Health Services. Smoking cessation has so many benefits. In your first day of quitting, your risk of heart attack starts to go down, and this continues with each additional day. In the coming days, you will be able to taste and smell better as those receptors that have been damaged start to heal. In the first couple weeks, your breathing will be improved, your blood flow will be improved, and your cravings should ease. After about a month, your withdrawal symptoms will have largely disappeared, and you've made it through the most difficult time. After a year, your rate of decline of lung function has been to normal levels, and you will be able to breathe much easier. Your lungs will even appear to be healthier from the inside, and that black lung look will have decreased. Now, let's revisit that pre-test, but now in the form of a post-test. Can you provide at least one reason why people use tobacco products, or at least one consequence of tobacco use? Can you think of one method of the cessation of tobacco product use? Can you think of one symptom of withdrawal, one support option? And what is one benefit of the cessation of tobacco use? More information can be found at these sources.